better quality. This is a hemodialysis machine in 1950, and this is nowadays the hemodialysis machine. This means a better progress in the field of nephrology. And also this is a dialyzer in 1940, and this is a dialyzer in 1960, and nowadays this is a dialyzer in our hemodialysis patients. My agenda will include all these points. I hope, inshallah, to finish on time. Yes. First of all, I would like to, you must have your own manual in hemodialysis. If you don't have manual for any device you will buy, like mobile, like laptop, like TV, like video card, if you don't have manual, you cannot use this device properly. So in every dialysis unit, you must have your own manual. First thing in manual is the mission, vision, and goals. Mission is the cause of existence of this unit to serve our community at all levels by providing health care service through multidisciplinary team at highest international standard, covering all aspects of hemodialysis. You must have the highest international standards to cover all aspects of hemodialysis unit. This is the ideal mission of your unit. And you must have also your own vision, your own dreams. What is the vision of your unit? To be one of the best recognized healthcare providers in your locality, or at the national level or international level. You must have your own dreams. You must look forward to improve your service. And to achieve this vision, you must have specific goals. You must focus on patient and staff safety. You must focus in more and more education for patients and staff. And you must have confidentiality and respect to patient and staff. It is very important. The manual of hemodialysis must cover every aspect in dialysis unit. Every aspect. Even external cleaning of your machines, even disinfection of hemodialysis machine, how to deal with your patient, fistula breaking, and the care of catheter. Every aspect in hemodialysis must be included in this manual. And when you write policy and procedure for every aspect, you must achieve these 9 points. What is the purpose? Policy statement, definition, procedures, forms, attachment and flow charts, materials and equipment, review of history, reference and approval. Must be approved. And when I'm speaking about forms for attachment, any form including your own dialysis unit, you must have policy for this form. Who will write this form? At what time you must fill this form? What is meant by this form? What is the importance of this form? When you will put this form at the end of dialysis, how can you use this form for the interpretation of your service? It is very important to have policies and procedures in your manual to cover every aspect in hemodialysis. Also have policy and procedure, patient focus, like dialysis request and patient-specific care, assessment of medical status of the patient, initiating and discontinuing dialysis treatment, nursing care during dialysis, fluid management during dialysis, intravenous drug administration, anticoagulant regimens. You must have policies for every point from these points. Also, what about diagnostic tests, including the frequency, at what time you will repeat these diagnostic tests, managing the vascular access, adequacy of dialysis, good blue arrest protocols, management of complications. You must have clinical practice guidelines, how to deal with your complication during dialysis. It is very important. Dialyzer selection and timing, total treatment, preparation and monitoring of dialysis. It is very important to cover all these points in your manual. Don't take anything to chance. This means that if you ask any person in the hemodialysis unit about specific policy, the answer will be the same. It is very important to have a common answer for all questions. If you have common answer for all questions for all the staff by the same methodology, You are totally right in your manual, and it is very important. Also, you must have manual for infection control regarding immunization guidelines, infection prevention, cleaning procedure, hand washing, handling of infectious waste, and handling of infected and contiguous patients. You must have policies and procedures for dealing with these problems. Also for equipment, operating and service manual must be available in the unit, and also you must have record for the repair of this, the repair of this machine, and you must have the risk code in the treatment area. Also regarding the safety, general safety, infection control, storing and handling of hazardous waste, electrical safety, fire safety, needle injury with contaminated items, stop immunization. You must have a manual covering all these aspects of hemodialysis. Housekeeping, daily, weekly, and monthly is very important to be covered in the manual. Also regular investigation, monthly investigation, and investigation every 3 months, and investigation every 6 months. Don't treat anyone with chance. Anything you are doing in dialysis, there must be policy and procedure in your manual. And there must be one answer from all doctors and from all nurses and from all workers working in the hemodialysis unit. Regarding better quality of life of hemodialysis, also for more better quality, you can use a high level of consumables, like high flux hemodialysis membrane. And you can put the indication for high flux hemodialysis membrane. If you have a specific number of high flux membranes, you must put in the indication for high flux. As we all fast know that the reduction ratio of beta 2 microglobulin after high flux was 60% in comparison to low flux, which is only 20%. So any patients more than 2 years or less than 3 years in hemodialysis, you must put this patient high flux if it is available to prevent later on dialysis-related amyloidosis. Also, if you have patients who still with residual kidney function, you must have how to preserve residual kidney function for those patients. Residual kidney function is a predictor of survival in hemodialysis. Sometimes we ask the patient to put the patient on hemodialysis with still residual kidney function about 15%. So for this residual what you will do to keep this residual level of kidney function for a long time? You must avoid the toxic medications, you must put this patient twice weekly, you must avoid the hypertension to prevent more deterioration of kidney function, because residual renal function is very important in the survival of hemodialysis patients. Also, the comments of hemodialysis should be placed at least 3 times per week. Frequency twice weekly has decreased worldwide, because the most powerful determinant of serial removal is dialysis frequency rather than duration. So it is better to put your patient on 3 times in dialysis session per week, but 4 hours each, which is more important than if you put your patient twice per week, 6 hours each. Frequency is very important to remove solutes during dialysis. Also, your machines should be replaced between 7 and 10 years, or between 25,000 and 40,000 hours for use in hemodialysis. Regarding multidisciplinary team, yes, it is a multidisciplinary team. This is not a job of the doctors and the nurses only. You must have patient and the family educator to educate the patient everything. Awareness about kidney failure, about choice of renal replacement therapy, compliance with dietary and fluid instructions, compliance with medication, significance of blood tests. It is very important to know how to get vascular access, good hygiene and infection control, awareness, and the prevention and management of several diseases. This is from the patient and the family educator. Also must have social worker to discuss the medical condition of the patient with doctors and nurses. And this patient is handicapped, the social worker can solve his problem. That is very important to discuss the medical condition of the social worker to solve the emotional and psychological, or to give the emotional and psychological support of their patients and families. Also, renal dietitian is a very important role, and she must be. A renal dietitian has a very important role regarding the nutritional assessment and reassessment and current malnutrition related to renal failure, dietary history habits. A renal dietitian must be aware about the results of investigations. He must know what is hyperkalemia and what is hyperphosphatemia, what is hypocalcemia, to give better instruction for the patient regarding the diet. What is the low potassium diet, what is the low phosphorus diet, what is the high calcium diet. It is very important for the renal dietitian to be aware about the results of investigations and to discuss this issue with the patient and with the family. Also, the role of biomed is very important in our teamwork regarding disinfection and water treatment unit, regarding how to check daily and monthly and yearly the water treatment. It is very important for the biomed, for the quality of the machines and the quality of water treated unit. And pharmacist also has very important role regarding drug-related problems. The contribution to resolution of drug-related problem, it is very important. There are a lot of medication which can affect the health of the patient. There is a lot of medication which can be taken on empty stomach. There are a lot of medication which must be taken at night for proper work. It is very important for the pharmacist to discuss the issue of medication with the patient. Regarding the vascular access, I don't take this issue in depth, but 65% of all patients commencing hemodialysis should commence with AV fistula. This means that the decision should be taken on chronic kidney disease stage 4 or early stage 5. It is very important. This is one of the quality measures. What is the percentage of patients commencing hemodialysis with AV fistula? This means for us in a better nephrology service, because the nephrologist will pick up the chronic renal failure patient early, he will ask for AV fistula early, and this patient will avoid the catheter insertion, the catheter used during hemodialysis, which is very important. And at any time, when you will do prevalence in hemodialysis patients, at least 85% of those patients must receive dialysis via functional AV fistula. If it is less than this means that it is increasing the number of catheter insertion, increasing the number of catheter-related infection, which is not optimum for the hemodialysis patient. So at any time, the prevalence of hemodialysis, prevalence of fistula in hemodialysis patient must be about 85% of patients. The AV fistula must be placed at minimum at 3 months prior to commencement of hemodialysis, but not more than 1 year. If you are using the AV graft, can be the time maybe earlier than 3 months, can be 2 weeks or 3 weeks. Well, now there is a new graft which can be used within 72 hours. Tunnel catheter should be the preferred for all patients. If you are planning to do hemodialysis for more than 3 weeks, you must put your patient of catheter on tunnel catheter, not on the temporary catheter, which is very important. Tunnel catheter, the incidence of infection, tunnel catheter is significantly lower than the temporary catheter. Regarding water treatment unit, which is very important point, they recommended that the complete water treatment storage and distribution system must meet the requirements of AMI standards. It is very important to know the AMI standards for the water treatment unit. It is the worst way to help patient in hemodialysis is through the water system. If you look to this statement, the worst way to help patients is through the water system, so it is expected that you know what is going on. every physician dealing with hemodialysis unit must be aware about the ideal treated water, the ideal quality of treated water. He must be aware of AMI standards. Because if you look here, all of us know that the patient with hemodialysis will be exposed during a 4-hour dialysis to 120 liter water. It's very important, 120 liter. Yeah, during the week, about 300 liters will be exposed to 300 liters of water during hemodialysis. This water will pass through a semi-permeable membrane. All of us, if drink 1.5 liter per day, this means that we are taking about 10 or 12 liters per week. 10 to 12 liters passing through the GIT. But this is 300 liters through a semi-permeable membrane. So it is very important that water represents a major risk for hemodialysis patients. So any physician, any nephrologist,